Roshini, Rajkumar back with you. May is Skin Cancer Awareness Month. Yes, and it is already May 3rd, and we want you to be protected. You need to really protect yourself from the sun all year long, but of course people really start focusing on it as we head into summer. So to sort of debunk some of the myths and give us a reality check, I've asked Dr. Jeremy Cook to come in studio. He's with Dermatology Consultants. Hi, Dr. Cook.
Hi, thanks for having me.
It's great to have you in here. All right, so how bad is the skin cancer issue?
It's pretty bad. So this year alone, we can expect to have about 3.5 million cases of skin cancer diagnosed in 2.5 million Americans, making it the most common cancer in the U.S.
That is amazing. Now, they call it a lifestyle disease. What does that mean?
Well, most skin cancers, including the most common 3 skin cancers, primarily the risk is affected by your sun exposure, both in the short term and in the long term. So modifying your lifestyle can make a big difference in your risk. For instance, people who take sunny vacations 2 or 3 times a year and go for a week to Mexico and get fried and come back, that dramatically increases their risk of skin cancer. Here in Minnesota, where we are inside for 6 months of the year during the winter and don't have a lot of sun, we come out in the summer, do our running, our boating, and tend to get really intense sun exposure for a short amount of time, which our skin really isn't ready for.
Okay, because it is a lifestyle disease, I also understand it's also really preventable. So what are some good tips you have for listeners in CCO land?
Yep, so skin cancer is definitely a preventable cancer for the most part. 90% of melanoma skin cancers are related to sun exposure, so definitely protecting yourself from the sun is the most important thing. Some things you can do, sunscreens. You want to wear a sunscreen with an SPF of at least 30. I tend to recommend an SPF of 50 in my practice. Studies have shown that if you wear a sunscreen the way most people apply it, you're getting about half the effective SPF. So if you put on a 50, you're really getting a 30, and that's what the American Academy of Dermatology recommends to protect yourself.
When you say the way most people wear it, what do you mean? They're not wearing it right?
Correct. Most people tend to under-apply sunscreen. Most people don't like sunscreen. They don't like putting it on. It's, in some cases, greasy. So they'll put a little bit on their arms, a little bit on their face, and call it good. Really, you need a decent amount, especially if you're covering your whole body. They talk about 1 ounce, which is about the size of your palm if you're just putting it on your palm. Otherwise, it's about half of a shot glass for those of you who find that to be a more useful measuring stick.
Well, and it's for me, it's like sometimes hard to, just get it pressed in enough. Otherwise, it just looks like you have this white film all over the place.
Mm-hmm. And that's a common issue with some of the older sunscreens that were available. Now we have sunscreens based on nanotechnology, so these physical blockers like zinc oxide and titanium dioxide are being made into nanoparticles, which rub into the skin very well and create less of that white shine that you're used to seeing.
I'm talking with Dr. Jeremy Cook. He is a dermatologist with Dermatology Consultants. If you have any questions for him, give us a ring or text us. The text line 81807. You can also call 651-989-9226 or 866-989-9226. Do you have something on your arm or your leg or your tummy that you're kind of wondering about? He might be able to give you a little heads up what you should be asking your doctor about and, just some other protection issues. So let us know. We'd love to hear from you. What about the whole UVA versus UVB, and how do we keep that all coordinated?
Yeah, so UVB is the form of UV radiation that causes burns, so UVB, B for burns. UVA is the form of radiation that tends to cause more of the chronic sun-related changes, but both are important in the formation of skin cancer. That's why when you look for a sunscreen, you want to make sure you're looking for something that is broad spectrum that covers both UVA and UVB radiation.
Okay, so I looked up some statistics, doctor, and these might be a little dated, but at least 13 million Americans, probably more now, are living with a history of non-melanoma skin cancer, and nearly 1 million Americans are living with a history of melanoma, the most dangerous form of skin cancer. So what are the differences between non-melanoma and melanoma?
So melanoma skin cancer is the most deadly form of skin cancer. They tend to look like a mole that's somewhat funny in shape or color. And in fact, they're derived from the same cells that make our moles, the melanocyte, which is also what produces the pigment in our skin. The non-melanoma skin cancers are, in fact, the more common types of skin cancer. They're not as dangerous, but they can be disfiguring and disforming if they're left to grow and go untreated long enough. And those include basal cell carcinoma and squamous cell carcinoma.
So, I mean, a good rule is if in doubt, just go get it checked.
Definitely. I tell my patients anything that's changing, growing, bleeding, tender, failing to heal within a month, make sure you come in and get checked.
All right. Jim is on the line from Minneapolis. Hi, Jim.
Yeah, hi. I was just calling. I kind of got the last part of that about any kind of changes or whatever. I've had a problem with the tip of my ear on the very outer lobe, and it's been something that's been there for quite some time, probably like the last 4.5, 5 months. And I've also noticed that I'm getting a weird, like, tickling sensation in that same ear too.
Yeah, so abnormal sensations, pain, itching, bleeding, those sort of symptoms are definitely concerning for the development of skin cancer. If it's inside your ear, it may or may not be related, but a new spot that's been on your ear, which is a high-risk area for skin cancer, and is not going away, should probably warrants an evaluation with a dermatologist or your primary care doctor.
And so when Jim was saying the tingling, I mean, I guess you don't even think about that as a warning sign that you should be aware of.
Yeah, and it's not one of the most typical ones we counsel patients about, but certainly any abnormal sensation related to a spot or growth should be a concern.
All right. Well, thanks for calling in, Jim. If you have any questions for Dr. Cook, give us a text 81807 or call 651-989-9226 or 866-989-9226. And we do have a text coming in, Doctor. Can you still get tan wearing a sunblock?
Yes, you can. So with sunblocks, so an SPF 30 blocks about 95% of the sun's radiation. An SPF 50 blocks about 98% of the sun's radiation. So if you're out in the sun long enough, you still can tan through sunscreens. Now, of course, we tell people, it's all about reapplication as well. So if you're sweating, swimming out longer than 2 hours, you definitely need to reapply, or you're going to see that protection wane with time.
Okay, what about tanning beds? I mean, those just seem like cancer beds to me.
They are. The World Health Organization agrees completely with you. They've labeled them as a carcinogen on par with tobacco.
Wow.
So if you're under 30 and have tanned, it increases your risk of melanoma by 75%.
So why are people still, like these tanning operations, no offense to those business owners, but these are everywhere?
They are. People like that nice, healthy glow that a tan gives them. I think that perception is changing to some extent as people become more aware of the harmful effects of tanning on the skin. But there's still that want out there for that nice, healthy tan. The other part of things, the vitamin D issue, which is such a hot topic in medicine right now. The tanning bed industry is really promoting tanning beds as a safe way to get your vitamin D, when in reality all it takes is a varied diet, maybe a little bit of supplemental vitamin D. You don't need to get it certainly in a tanning bed, and you certainly don't need to get it outside.
I wonder which PR person gave them that advice. That's a little weird. All right, we have a text coming in. Family member, young adult, non-sun tanner, still got melanoma, to mole removed, no further treatment except 6 months, now yearly checkups. Do you kind of get that in? How this person wants to know how likely could this return?
So it depends on the stage of the melanoma. Most melanomas are diagnosed quite early nowadays, now that people are more aware of what they should be watching for. But that question's a little hard to answer in absence of more specific details. In terms of the risk of a second melanoma, it's probably about 5% in their lifetime. The risk of the initial melanoma coming back is greatest in the first 2 years. And then once you get through the 5-year window, you can kind of breathe a sigh of relief. That being said, there's always a chance, even after that 5-year period, that it could come back. Fortunately, with the lower stage cancers, the 5-year survival for a stage 0 melanoma, so a melanoma that hasn't invaded below the top layer of the skin, is about 99% with proper treatment. And for stage 1A cancer, which is mostly what I see in my practice, the survival rate at 5 years is about 95%. So these are curable.
Yeah, good. Well, those are some good statistics. So to most of us lay people, can we tell the difference between just a safe mole and something that could be cancerous?
Most of the time, I find patients are quite good at picking out problematic moles, with some exceptions. But we get husbands coming in all the time because their wife made them come in to get this spot on their back checked, and sometimes it's fine and sometimes it's not. So patients do tend to have a sense sometimes about moles and if they're abnormal. So as a dermatologist, I may look at something and think it looks, okay, mostly normal. But if a patient's really worried about it, I always factor that into my decision on whether or not to remove it.
All right. Audrey's calling in from Columbia Heights. Hi, Audrey.
Hi. I'm just naturally white, and I don't tan hardly at all. I mean, I never lay out in the sun and all that stuff. I did when I was younger, but now I'm just white, and I was wondering, is there any danger to getting those spray tans? And I will hang up and listen.
Yeah, so the spray tanning issue is a good one to raise. The spray tans, essentially how they work is they create a carbohydrate on the outside of your skin. So basically they create a sugar on your skin, which is why they look a little orangey brown.
Not natural.
It depends where you go, and sometimes, it's a little bit more orange than you'd like, but they are completely safe as far as we know. Again, it's just creating a sugar on the outside of your skin. And it does create a sun protection factor of about 4. So you're actually doing yourself a favor by getting it because it is protecting you against the sun. But
preferably put on some sunblock before then.
Definitely you're going to want sunscreen in addition to your spray tan.
Okay. All right. Lou is calling in from Owatonna. Hi, Lou.
Hi. I had melanoma skin cancer surgery 3 years ago and was very successful. But I recently read a report that working under fluorescent lights, you're 2 times more likely to get melanoma from fluorescent lights than you are from the sun. Have you heard anything about that?
I'm not sure I've seen that study. Certainly the UV lights used in tanning beds dramatically increase your risk of skin cancer and, most importantly, melanoma. But the UV lights, or the fluorescent lights in offices and things of that nature, I have not seen any studies that they increase the risk of skin cancer.
I had worked in an office under fluorescent lights for 45 years. And so, whenever I went outside, 99% of the time, I always wore a cap, even as a kid.
Which is smart, very smart, Lou.
Yes.
Yeah. Well, lots of questions coming in for you. Dave from Maple Grove. Hi, Dave.
Hi. I had a comment first and then a question. When she mentioned about the wives and the spot on the back, I have a brother who's a professor at George Mason, and he said he knows why the insurance actuarial tables give longer life expectancy to married people, because a friend of his wife spotted a mark on his back, and that probably saved his life.
That's a nice little message a week before Mother's Day, Dave.
Yeah. And then I was going to mention, when I was a kid, I'm very fair. And when I was a kid or a young person, many times I get actual water blisters from the sunburns, and sometimes pretty severe. I suppose my risk of cancer is pretty high.
Yeah, so even one blistering sunburn increases your risk of melanoma by about 50%. That sounds like a lot, but it's a relatively small increased risk when you look at the actual numbers. But if you're fair-skinned and you have that history, you're definitely someone who should get a baseline skin cancer screening just to make sure there aren't any problems.
All right, we are winding down our time with Dr. Jeremy Cook. It's amazing, this topic. It is Skin Cancer Awareness Month, the month of May, and we definitely want you to stay safe. As the doctor has said, put on that sunblock, at least a 30. He recommends a 50. Wear covered clothing. Of course, kids also really need to be careful.
Yep, so kids younger than 6 months don't have an FDA-approved sunscreen for their use, so protective clothing is definitely the way to go there.
The way to go. All right. Dr. Jeremy Cook with Dermatology Consultants, thanks for coming in.